Thanks everyone for returning after lunch. Okay, so just going to start with a little reminder from this morning of the criteria that Mr. Justice Poole stated for somebody to demonstrate the capacity to grant lasting power of attorney. So that was thinking about the effect of the lasting power of attorney, who the attorneys are, the scope of the attorney's powers, and that the MCA restricts the exercise of their powers, or at least should do, when the attorneys can exercise those powers, and that you need to execute the LPA, send it off properly to the OPG and receive it back before it comes into effect, the scope of the person's assets that the attorney can deal with under the LPA, the power of the donor to revoke the LPA if they have capacity to do so, and the pros and cons. Now, some of the things on this list is the same information for everybody, and some of the items on this list are individual specific. So who you would choose as the attorney would be person specific, but things like what is an LPA and what is the scope of the powers under LPA should be standard. So somebody who has had a brain injury and has, say, for example, memory difficulties and speech difficulties, some of the challenges in doing a capacity assessment could be looking at what they're able to communicate, and some of it can be what they're able to remember. But somebody can sometimes gain the ability to demonstrate capacity to grant LPA if they want to, if they have the right support to do so. So we'll talk a little bit about that. So the first one that we're going to look at is what can be done in terms of helping the person to understand the information that you are giving them, but also what can be done to help them to communicate their wishes, which is very important. So I'm going to pass now over to Sarah, our lead SLT, to talk a bit about what the SLTs are able to deliver and why they're so invaluable for capacity assessments.
Thank you, Alana. I'm just thinking about where to stand. Shall I come stand here? Hi, everyone. So I'm Sarah Gibbon. I'm speech and language therapist with Arbor, and myself and Kester are the, what do we call ourselves, co-directors of Arbor. And just to give you a little bit of background to Arbor, we really have always valued the importance of MDT working, and that's the heart of Arbor. And within that, working alongside neuropsychology, occupational therapy is kind of the core part of our jobs. And so working on working with Alana and trying to support capacity decisions is very much integral to our everyday work, really. Now, looking around the room, there's a range of professions here, so I apologise if you know the information on this slide, but I thought it might be helpful for me to go through some of the regularly used terminology that we encounter in speech and language therapy, because they can be quite confusing. So as a speech and language therapist, our role is to support and optimise an individual's ability to communicate. And by communicating, we're looking at people's ability to interact within their immediate environment and with the key people around them. And depending on the severity of the brain injury, that may be looking at whether someone can communicate their basic daily needs. A yes/no output is often an early stage area of the assessment that we would look at in hospital. But it can be right up to people who are very high functioning, and we're looking at much more in-depth, complex language assessment. So just to start by identifying some of the communication difficulties that we come across. And as speech and language therapists, we are looking at speech and language as being two very different parts of human ability. And so because they're different parts of the brain that are responsible for those functions. So first of all, we'd be thinking about, okay, is there a speech disorder presenting with this patient? And by that, we mean how clear can somebody be when they're talking? Is there evidence of a dysarthria or a dyspraxia? So with dysarthria, it typically presents as someone that finds it hard to make themselves understood in terms of articulation. So you might hear slurred speech, you might hear someone who's very low volume, some people find it hard to change the pitch of their voice so they can sound very monotone. And that presents as a physical speech difficulty that can be so severe that, as Alana said with your example, that people cannot understand what that person is saying. And it may be that the person is only communicating at a single word level, or even the example of the yes, no. Sometimes people get that they can just say yes or just say no, and that's their response for everything. And the only way you can tell a change in how they're trying to be interpreted is if they change the tone of that word. So that can be a very severe example of dysarthria. And a dyspraxia is a motor speech disorder as well, and that can present slightly differently, but essentially makes a person non-fluent, and can be very difficult for someone to generate and initiate communication. So as a speech and language therapist, it's our job to identify whether that motor speech impairment is there, because it can be almost like a red herring. So you can think, oh, that person can't communicate, but it can just purely be a motor speech disorder, and actually the language is intact. And that's a really important part of the speech therapist's role, is to make sure the team working with that individual knows and understands the nature of the disorder. I think more people are familiar with the term aphasia, which is the acquired language impairment. So that can affect understanding and expression verbally. So when you're having a verbal exchange, but also reading information and written language. So the actual physical act of writing would be our occupational therapy colleagues' area, but the language and the spelling and the word order and being able to produce a coherent piece of text would maybe fall under the language disorder of written language difficulties. So it's important to understand the difference and to know what it is that's causing the communication difficulty. And then on top of that, there's the obvious cognitive changes, which I'll come on to in a moment. But we would look at assessing somebody in the early stages of rehab and identifying what's changed about their communication, and what we're noticing day to day, what's making it difficult for people to communicate. So we can do that with formal language assessment, but also just in observing people in daily life and seeing how they're getting on in interactions. And functionally, are they able to request items? Are they able to ask questions? Can they interact with their immediate environment? So it's really important to establish that early on, and make sure the team are up to date with what your findings are. Which, how do I move on, Norma?
I've used
Thank you. So the other aspect after brain injury is particularly after traumatic brain injury, is cognitive communication difficulties. And these are our little miss pictures here represent the two kind of camps of presentation that we can see after brain injury. So you tend to get people who will describe changes as being a deficiency or an exacerbation of a previous presentation. And the little miss shy are those kind of clients that we meet that are very flat. They don't give you much feedback. That's very difficult for them to initiate, to generate language, and they find it really hard to keep a conversation going. So it can feel really hard work to try and keep somebody talking. They're very passive. The other extreme is where you get people who are very verbose and just talk constantly, the little Miss Chatterboxes of the world, who don't pick up on the signs around them that they should stop talking, just keep going, jump, topics constantly, interrupt people, talk over the top, say things that may be a bit inappropriate because they're not monitoring what they're saying, and they can be equally exhausting because they just don't have an off switch. They'll just keep talking. And I think I can see a few smiles going around the room because we can all think of people we know that probably fall into two of those camps. But after a brain injury, it's obviously much more of a pronounced presentation and is there consistently. So it's that kind of that's just how that person then communicates. So as part of our work within the MDT, it would be the speech therapist's role to communicate what the changes are and how that's going to impact on somebody being able to give their capacity, decisions on what the care, finances. And we look at ways to optimize a person's ability to function and to communicate within the moment. And technology has a really important role to play within that. So one aspect is high tech AAC, and that can be complex iPads, eye gaze, looking at ways to support someone with very significant physical difficulties to communicate. I don't know whether everyone's seen eye gaze in action. It's very, in the last 10, 15 years, the technology has just absolutely raced ahead, and it's so powerful now how people can communicate. But somebody who can only interact using eye movements and select pictures, words, whatever it is that has been shown to be effective, are able to form sentences and have a device that's got voice output that people can communicate. And so it's very much the role of the speech therapist to make sure in those situations that that person's voice is heard within all decisions, within healthcare, within finance, within the family, and to enable everybody around that person to be upskilled in communicating with someone who's communicating differently. Because it's one thing the person themselves being able to communicate using eye gaze, but it's also those key conversational people or your MDT or whoever it is that also need to feel confident to communicate with that person. Technology can't fix everything. And I think that's also an important consideration. So for some people, it's not going to be something that is helpful. If they've got such significant cognitive impairment, they just have not got the ability to understand why they'd want to interact with their environment anymore or what they would say, then putting them in front of an iPad is not going to fix everything. And I say that because unfortunately I'm looking at Catherine as well, we've both had experiences as speech therapists of certain medical professionals thinking just give them an iPad and everything's going to be okay. It's for some people, yes, it definitely can help, but it's about training the team to realize that communication is more than just pressing buttons on a machine, and it's about that ability to process and understand. So it would be definitely something that we would explore. And of course, if anyone can use technology, it doesn't have to be an iPad. It could be switch work, looking at whether you can indicate a yes no response. If you can't say it verbally, can somebody indicate it with a switch or one of those big buttons? So there's lots of ways we can use technology. It doesn't have to be all singing, all dancing. Sorry, let's go to the next slide. So looking at supporting communication difficulties, the lower tech versions of communication aids may just be something as simple as pen and paper. And I still do use that with people. It's, it's often a natural response for somebody to want to pick up a pen and attempt to write. And I think, Alana, you mentioned a total communication approach. And whenever we have clients with communication difficulties, that's always the optimum way of supporting someone to interact. So if speech is difficult, because speech is always going to be everybody's first choice and first attempt, if that's too difficult, can they write it down? Can they draw it? Can they gesture it? Can they point to it? can they use any resource within their environment to support communication? And so as speech therapists, we would explore that, look at whether prompt cards help, whether it's written words on the prompt card. Is it a picture? A photograph is the simplest and most effective way of often getting someone to understand what you, so in terms of a kind of visual processing perspective, a photograph is the most effective way for someone to understand your question or information. But if they can they cope with symbols? Can they cope with a pictorial representation of what it is you want them to communicate? Alphabet charts and E-trans frames. I don't know whether people have come across it. It's like a perspex frame. You can have a yes, no on it, and you can have different letters of the alphabet, and one person would hold the frame up, the other person the other side, and you'd look to the eye gaze where someone's spelling. If anyone's read, there's a book called The Diving Bell and the Butterfly, which is very well known, and I think that was written using an E-trans frame. So it's slow and it takes a lot of time and it takes a lot of skill of the people around you, but it just shows that having a physical speech difficulty doesn't mean you can't communicate, and you are still able to put your message across. In terms of understanding information as part of your capacity assessment, we would look at whether the information can be adapted to facilitate understanding. So the kind of reasonable adjustments we're looking at, it may just be that it needs to be a larger font size, and that could be a starting point. It could be that it needs to be broken up and visually displayed differently, different colours. So we'd look at all those sorts of aspects of changing the font. Making sure the very key points are highlighted, repeated, presented multiple times, and that would be part of the rehab, part of supporting somebody to see whether, if the information is presented in an accessible way, are they able to take it on board? Can they process it? Can they understand it? So that could be part of the therapy that you would be giving to support someone to achieve capacity. And you'd also look at what other ways to support decision making. And we mentioned earlier about talking mats, which has been around for a very long time. And I was just saying to Nikki, this is going to make me sound really old, but when we first started using it, it was literally a piece of carpet, like a carpet mat with pictures of Velcro. And it still works. It's got much whizzier in that you can have it on an iPad now and move things around on the screen, but I would still use the mat. And it's, if you're not familiar with it, you'd have a topic that you were looking into. So let's say choosing activities in the community, and you'd have pictures, words, whatever it is on your cards, and there'd be 3 columns, one with yes or like, one with no, dislike, and one with not sure in the middle. And you would look at each card and ask somebody to place where they would put that card. So it's a very simple idea, but it's really effective and can be used and applied to a whole range of decisions, and giving someone the ability to express their opinion when language is difficult. So that's also a very useful tool when you're supporting these discussions. So, shall I hand over? Oh, thank you.
So thinking now, I had an example this morning where somebody had demonstrated capacity to grant LPA, but not for finances, and all of that previous assessment by speech therapy that then allowed me to have individualised recommendations for doing my assessment. That was pivotal in that person being able to communicate their wishes, and for me to be able to document, I gave them this picture, they placed it here on the talking mat. But then all of that is documented, all of those stages, how you would, at the beginning of the assessment, you might ask some questions like, is your name so-and-so? Is your name a different name? So that you have established, just for the purpose of the report, that that person can answer at that time and that they are fully oriented at the time of the assessment. And all of that is not possible sometimes without specific individualized speech therapy recommendations. But now I'm going to talk a bit about what we do in neuropsychology to also aid people being able to demonstrate capacity. So we're very focused on the second principle this afternoon of how we support people to understand and to weigh up and communicate. So there's quite a few memory strategies that are particularly important for lasting power of attorney assessments, because there's so much of that information that is generic across everyone. So things like, what is an LPA? To have capacity to grant LPA, you have to have learned that information. With finances, there are some things that are generic, like you've probably got bills to pay, but after that, everybody's life is different, so everybody's finance is different. So it's particularly helpful for these LPA assessments. Looking at possibly starting with a cognitive assessment to look at the person's individual profiles of strengths and weaknesses. Memory-wise, do they particularly do well with visual information? Do they do well with verbal information? I particularly like a total communication approach as default because it covers a bit of both. And then also you can say that you in your report that yes, you have taken these practical steps. It's even on the COP3 form, like what steps did you take to help the person? Here's my list. Also for LPA, looking at multiple sessions of learning. So particularly when I've been working in an inpatient setting and I can send either me or my assistant to drill the same information again and again and again, for the stuff that needs to be learnt, as opposed to the stuff like, who do I trust to be my attorney, which the person has to generate themselves, then that is absolutely possible and very much worth it, particularly if you're trying to support discharge to somewhere and the LPA is going to help with that. Also, there's some techniques that we use in general to support memory. Spaced retrieval is giving someone a piece of information, a small piece of information, asking them to repeat it back. You do that a few times, and then you gradually increase the interval of time before you ask, what is an LPA? Is an LPA a legal document? That kind of thing. And you do that for a few sessions. There's research, and I've seen it happen, that you increase the chance of that information making it into longer term memory, not just staying within that session. So if you're doing that across multiple sessions, then by the time you get to assessment, the person should have already encoded that information to keep. Errorless learning can be very important in that, particularly with people with brain injury, if they make a mistake on something and then you say, oh no, that's not right. If they're like, oh no, damn it, I got that one wrong, and they have an emotional, even a slight emotional response to that, it increases the encoding of the mistake. So we may have all experienced that. If you've got somebody's name wrong and then you're told the correct one, I've had it there. I'm like, who's that? That's not Lucy. What's not Lucy's real name? I know it's not Lucy. Is it Lawrence? It's just not Lucy. And how many times have I just said Lucy to myself? That's their name now. Like, they have to stick with it. That's it. That's very much and increasingly the case for people with brain injury, that if they have had a memory lapse or something, they've got something wrong, and then they're even slightly irritated or embarrassed by that emotion will increase the chance of encoding. So errorless learning is that you give them a chance to think, but if they don't have the answer straight away, you tell them what the answer is. They don't end up saying the wrong answer and then remembering that wrong answer. I find it better to do, if they want both lasting power of attorneys, I do them separately and I leave a gap in between each one, because quite often with my card sort, my red herring cards that I'm doing with the person might be things from the other LPA. And if people are trying to do it together, it can be a nightmare of working out, have they not understood what the finances one is? Or are they saying, yes, the person will be able to decide on my medications because they're also going for health and welfare. So right from the start, I'm like, decide which one is more important. We're starting with that. We're going to do all of that before we even think about the next one, because otherwise you end up with your red herring cards are yeses for one assessment and no's for the other. and you're just making it more difficult for the person. So quite often they might start with finances because there's bills that need to be paid or things that need to move forward. And then after that's achieved, we'd leave a gap and then start again with health and welfare. Talking mats helps with memory as well, not just communication, because when the mat is there and the person has placed all their cards, and then you're asking them to weigh up the information and make a decision, you are supporting their working memory because it's all visually there in front of them. So they're not having to hold it in mind in the same way whilst they're weighing up and giving their decision. So it's a really helpful memory aid, not just a communication aid. And finally, I love a pros and cons table. So if somebody's got 2 or 3 options, pros and cons for each one as we go through. And that gives additional value to the report as well, because I will highlight what information I said to the person and what they personally generated. And we'll do that, we'll co-create the pros and cons tables in the assessment so they can see the work come to life in front of them. But also I can be clear, somebody's generated these points themselves. Well, they remembered it because I didn't tell them and they remembered it, they told me, so it's already in their memory. So that helps as well when thinking about understanding, remembering, weighing up, communicating. The next point of the pros and cons table, it helps support executive abilities as well. So particularly thinking about that weighing up. If somebody struggles to look at the totality of the information, so looking at the options holistically and not just individual factors, then we might look at, well, can you rank the importance of the factors? Are there any that particularly stick out to you as being, deal breakers, basically? So you could have somebody's created a list with just a few pros and quite a few cons, but if something in that pro side is absolutely necessary to them, versus the other way around, could be a lot of advantages and there's only a few cons, but one of them is an absolute deal breaker, then that can be important. It's not just the number of factors on each side, but the value the person themselves assigns to those factors. Because what you can see is somebody's able to comment on each individual factor that you discuss with them, and then they look at the whole lot and it's just too much. And even it would be the case that even if somebody does not have capacity, again, from that 2019 judgment, Sir Mark Headley, that I said was very good this morning, he noted that the closer somebody is to having capacity, the more weight you must put on their wishes in a best interest decision. So even if the person looks like they're 3 options and now they've got a load of pros and cons, it's all just too much. If they're able to rank what the really important factors are for themselves in the pros and the cons, you should take that forward into the best interest decision-making process. Can the person communicate not just which option they want, but why they want that? So in the end, this option, because that pro is really important to me, and over here, that con is a deal breaker in that other option, even if it might be, oh, there's lots of pros for that option you don't want and lots of cons for this option you do want. Again, it's about that ranking and can they express why, what the overall reasoning is to choose that option, not just I want that one. Again, thinking about LPAs, we mentioned this morning, it's important that the person is able to talk about the hypothetical risks or communicate an understanding, it doesn't have to be spoken word, of hypothetical risks, even if they don't think that the person they want to appoint as attorney would do these things. So I do require that people understand that there is a risk, and then to be able to say, I don't think my loved one would do that as my attorney because they've helped me in the past and they've never done these nefarious things. But if somebody just says, oh no, there's no risks, that's a problem for me in terms of capacity. And again, as an assessor, you must be satisfied before becoming the certificate provider, and that's just both in terms of capacity and also safeguarding risks. Moving on now to finances. So we talked this morning about what is included in the assessment that I use to look at somebody's capacity and capability to manage their own finances, going through from simple things such as understanding numbers, money, values of coins and notes, maybe how to use their bank card, all the way through to everyday budgeting, weekly, monthly, and then longer term investments and vulnerabilities. I will, at the end, I tend to do assessments, more complex ones, over 2 days, and that has a number of advantages. Fatigue management, certainly, having plenty of time to cover all the content that I want. Sometimes I might look over my notes at the end of the first day and realise I've got follow-up questions, like I think I've done these bits already, and I'm like, ooh, I got some follow-up questions there. I didn't dig down enough into these bits. It's not uncommon for somebody looking like they might have capacity to manage their finances, for them not to have particularly looked into something like personal injury trusts. So it's also not uncommon for me to leave information on personal injury trusts and their options at the end of that first day for people to really consider before I see them again on the second day. And it's also not uncommon that if somebody decides they need more time just to look into that and to speak with their deputies and look at the options, because deputies quite often become trustees. You don't necessarily lose your deputy, you just change their role if you're switching across to a personal injury trust with capacity. Sometimes I might do that as like a follow-up final video call if it's just a few bits of information, but they want more time to look into that. And actually that speaks to a person having capacity if they're not impulsively making decisions, but saying, I need more time, I want to speak to my deputy, I've got to do research. I'm like, great, that's what we like to hear. Sometimes people can look through and they're happy with what they've looked at overnight. But one of the other major advantages is it's usually the case that I will know what I think before I've left them at the end of the second session. And so I tend to give, unless there's a specific reason not to, I would tend to give feedback at the end of that assessment and not leave it to the deputy, who then may have an angry client. It's like, what do you mean I don't get all my money? So I will discuss that with the person, and if they have objections, they can raise that at that time. That also can springboard a very useful conversation into what is needed if they haven't demonstrated capacity, what the next stages would be for them to do so. So, for example, courts like evidence, but I'm also mindful of the saying, absence of evidence is not evidence of absence. So if somebody has been managing a certain amount of finances, maybe for years, and they think they're ready for the next stage, but there's no evidence they could, and there's previous evidence that they couldn't, but that was actually from years ago, I've said to a person, this is actually one of a case example, at the end they're like, but I can do it. I said, look, call him Dave. Dave, I can write down, yes, the court protection should give you all your money because Dave says it will be fine. They're not going to accept that in my report. So I can write it down for you, but they're just going to reject my report. But if you work with, say, an occupational therapist like Nikki, then you can create this evidence. We can start looking at the next level of finances. So could you take on all your bills and be paying them yourself? Or would you forget, or would you make mistakes? And he's like, I don't need to work with Nikki to do that. I can do it already. I'm like, great. You won't need to work too long with Nikki then. And then she can write a nice report about how great you did and you got it all right. And then there's your evidence for the court for next time. And they're like, all right then. And it can be then through doing that work with Nikki that they realise, oh, it's not as easy as all that. Oh, I did forget this. And then you've got now improved insight and something to work on. And then as long as you've got the buy-in, it really doesn't matter to me whether they're like, right, I'm going to work with Nikki just to prove I can, or I'm going to work with Nikki because I need to. As long as they accept Nikki can turn up and get started, then I'll leave that. That's a challenge for Nikki. But then you've got the person being able potentially to move on to managing the next level of finances, the next level of difficulty themselves, and also to point out that it's not all or nothing. So somebody might improve their capability to manage their own finances, and they may not get to the level of being able to choose their financial advisor, review how good their financial advisor has done that year. when the Ukraine war broke out, lots of people's settlements amount dropped, which I'm sure upset and worried a lot of clients. That doesn't mean you've got a bad financial advisor. It means all of the financial advisors are struggling with that problem. So they may not manage that level of complexity, but they might be able to pay their electricity bill. And if you're doing more of it yourself, that is likely going to reduce your deputyship costs. So there's value to doing the work, even if you don't get signed off as having full capacity at the next assessment, for example. And so that then can be the buy-in for actually you would benefit from working with an OT who can help you to take on more of that yourself successfully. And then you just need to agree. And then, as I say, we'll turn over to Nikki now in the work she does when they said, all right, then I'll see you. Okay, thank you.
So, hi everyone, I'm Nikki Jago, I'm the lead OT for Arbor. I'm just going to talk a little bit about the sort of OT assessment in relation to financial capacity. So as many of you, I'm sure, in the room will know, that OT is about evaluating a person's functional ability and cognitive skills, but in more of a real world context. So we like to know that these formal assessments have been completed, but you know, that us OTs know that sometimes you can then still take somebody into a real life situation and they perform a lot better than they are in their formal assessment. So it's always a good thing to do. We want to kind of look at how we might recommend that practical support, and looking back on those kind of principles for capacity. There is kind of that principle about all practical steps must be taken to help a person make their own decision. And that's kind of exactly what Alana's saying, that, you know, sometimes when you have a formal assessment, you know, you don't have capacity. We're taking practical steps within the assessment, but then we also need to think about those practical steps to support somebody with their capability. And also we're looking to try and empower individuals to make financial decisions safely, with as much independence as possible. So again, within the principle of the least restrictive option. So as Alana was saying, you know, you might have a client who can manage a weekly budget or can manage their monthly bills, and they should then be encouraged to do so to maintain that level of independence, but they might need assistance from a financial advisor or an attorney to look at their kind of pension or investments in their future. So, you know, when we're looking at this from a sort of OT perspective, we're thinking about a combination of kind of direct observation, some kind of structured interviews, and then that collateral information that might be coming in from Sarah, from Alana. So we're going to be looking at the very practical sort of aspects of managing money. So handling their daily spending, can they pay their bills on time? Do they have a weekly budget that they work towards and stick to? But also it's about being able to plan ahead and coping with those unexpected events. You know, your washing machine decides to give up and you've got to try and find the money to buy a new one or get it fixed. And kind of planning for the long term. So thinking about savings and what that means and what you might be saving for. We'll also be looking at making choices. So again, this is kind of more at that higher level end, but identifying and choosing appropriate financial products. And also that vulnerability that we've talked about, you know, can the person recognize, you know, fraud or scams, you know, because sometimes that happens to the best of us, whether we've had a brain injury or not, you know, scammers are getting more and more capable, unfortunately. So we want to be helping people to recognize that or to look for those kind of signs. And also what's really important, and particularly for people with brain injury that maybe struggle with their insight a little bit and understanding that maybe they are not as capable in this area as they may think they are, it's about getting that help, recognizing that you need help, but also knowing where to seek that advice as and when you recognize that. So again, you know, as I've said, with OT, we're kind of looking at the whole person and the whole picture. So we're looking at their cognitive skills, their physical skills, you know, in any kind of other area of their world that impacts on their ability to make these kinds of decisions. So we will be looking at evaluating their attention, their memory, their executive function, but again, in that real world context. So something that we might do, and often we might do this with the neuropsychologist as well, is something called a multiple errands test. I'm a real fan of these. I think they're really helpful. I've done quite a number where I'll take a client to Cribbs Causeway and I will give them a test, this multiple errands test to do, which is essentially having to go and purchase particular products, obtain information, but also there are a number of kind of rules to follow. And one of the rules is around, I'm going to give you £20. I don't want you to spend all of it. You can spend up to 15. So you're also then looking at, and it is a pretty high level from an executive function perspective, because you're giving them tasks to complete, but at the same time, they're also having to look at, I've got this budget, you know, which magazines are so expensive these days, am I going to choose? Because, you know, I've only got this amount of money to spend on these items. So that can be really helpful way of looking at not just that executive function, but also about, do they know what to do with money? Have they come back to you partway through the assessment and said, oh, well, I've spent the £20 and I still haven't got the items that I needed? And that's kind of a bit of a red flag for thinking, how are they managing those finances? Obviously, we'll also look at kind of physical abilities, so observing those fine motor skills for being able to kind of handle cash or signing documents, using bank machines, which can be physical and cognitive. And as I think it was Alana or Sarah saying earlier, if you have a client where, you know, they do have speech and language difficulties, but they also have like physical issues where they can't use a computer, and it's kind of all of those aspects coming together to make that they might be capable, but actually they can't show they're capable. And from an OT point of view, we're trying to think about ways to help show that they can be capable. I'm sure many of us have visited our clients' homes and thought, how on earth are they managing this when you walk in and everything's everywhere? And they say, well, yeah. Then you say, well, have you got this particular document or something that, and they say, yeah, it's in, I think it's in that cupboard over there. And it's all just very chaotic. So how they manage their home and kind of social kind of setting might have quite a big influence on their financial management, because if they can't get to the documents they need at the point that they need them, that can have quite an impact on decisions that they're making at that time. And again, around similarly to the multiple errands test, looking at that real world performance. So how the individual handles their own finances, rather than just, as Alana said, relying on their self-report. Yes, I'm fine with that. Thank you very much. Oh, okay. What's the evidence for that? And I've certainly worked with clients. You know, I've got an example of a young man who we were working on kind of meal planning and shopping. And he got really good at thinking of meals and getting a recipe together and writing a shopping list. And then we'd go shopping and he might get a few of the items on his list, but he'd also be there putting in lots of other things. And admittedly, we all do a bit of that. We go in for 3 items and we come out with 10. But every sort of time, and it got to a point where then, you know, I had to say to him, look, I'm a bit worried about how you're managing your finances, because we've got this shopping list and the last 3 times we've been shopping, you've spent double. And that's something that if Alana was then saying to me, I need to do a capacity assessment for this client, I'd be saying, these are my observations of real world situations where the client isn't demonstrating they're able to manage the financial budget that they have. So again, thinking about what we might do about that, how we might help somebody. So similarly to speech therapy, we might look at environmental and technological adaptations. So we might use phone apps for budgeting. We might look at setting up automatic bill payments to simplify those financial tasks. So making sure they have direct debits or standing orders set up for regular bill payments so they don't have to worry about it. I love going in and helping with a structured routine. That just, yeah, I'm very, I like kind of organising things, helping people to organise themselves, you know, creating those sort of financial documents. thinking about how to, and that's what I did with this gentleman in the end, is we sat and worked out what his weekly budget was for shopping. And we kind of allowed, within the scope of, it's fine to buy some extra treats or some things that you think, oh, I fancy that, that's fine, let's build that into the budget. We're not going to make it so restrictive, but then it's helping that person to try and maintain the budget that they've set for themselves, and just keeping things in a kind of designated place so that when they need to find something and get something, it's there to hand. And we all know as well that, and I know this will come up when looking at assessment, but it's about modifying the environment, reducing those distractions. Financial planning, financial decision making is a really high level task. And if the person you're working with is really distracted by other things that are going on in that environment, you're unlikely to get a true picture of what they can actually manage. So other things, we might look at skill building and training. So we might consider kind of hands-on activities. We might think about using money to practice tasks like sorting coins at the kind of really basic level where we're just starting to think about money management. We might look at role-playing some shopping scenarios. And that's about we might be looking at visual perception, their fine motor skills. We might be thinking about memory, categorization. So we're just at that point maybe starting to help someone consider this idea of what money is, what it's all about. We might look at bill payment, so practicing how to fill out kind of checks, not that we use them particularly these days, but certainly online banking. So, maybe having sessions with people around how does online banking work, what does it look like, and how to kind of set that up to make it as easy as possible for that person. Online shopping with a budget. And again, online shopping is great because, if you've got your kind of standard basket of things that you order each week, that's already set up for the client. So it's much less likely that they're going to go all around buying lots of additional items. So that can be really helpful. And also looking at budgeting practice. So sitting down with somebody, looking at how you might create their weekly or monthly budgets and help them track their income and things that are going out. And one thing that I wanted to say was about some of the clients, and I mainly work with brain injury clients, but some of the clients I work with are quite young people. And so I'm always looking at, would they have managed their finances before? Because some of these clients that I take, 16, 17-year-olds, possibly didn't really have their own money and their parents essentially managed the finances. So I'm always also looking at what's realistic for this person, because I might have to be starting from scratch in terms of what some of this financial language even is. There's not many 16, 17-year-olds that have even considered or know what something like a pension might be, or a how to invest in stocks and shares, or even a budget. They're like, what do you mean a weekly budget? And they have no idea. So sometimes it's about training them on something completely new, and that comes with its own difficulties, particularly when you've had a brain injury. And sometimes, in a situation where somebody either doesn't have that kind of financial ability or capability, or has a certain amount but to a degree, then it is about teaching family members how to provide support, but while still promoting their independence. So I think sometimes, particularly with younger people, their parents will often be like, well, they don't need to worry about that. I can manage that for them. But actually, most young people want, that have transitioning into adulthood, want to be able to take that on themselves. And so it's about how we support the people that are giving them, care, or their family, how to support them to make those decisions for themselves. We might need to collaborate with other professionals to sort of think about how those financial contexts can be more inclusive and accessible for the client. And again, as I said, we might need to be looking at doing financial coaching and providing sort of individualized guidance to help that client achieve their goals. before I go back to Alana, when I was looking into some of this and the document that Alana suggested earlier, they had a sort of section on the benefits of a financial passport, and I hadn't heard of one of those before. I don't know how many of you have heard of them or have clients that have them, but they're suggesting it can be helpful in informing others in a person's life, including professionals, that, you know, what help somebody might require in relation to their finances. So if they lack capacity and others are taking best interest decisions, it's sometimes beneficial for the person to have that kind of financial passport, and it covers some of things like information about the person's capacity and where it's appropriate to make those best interest decisions, where they might need the support, whether it's at the bank or elsewhere, what they like to spend their money on, where they might need support to make a decision. So there's lots of different kind of aspects, but I thought it's made me think about, actually that could be something that, you know, OT wise we support in terms of someone's been suggested that they don't have that capacity or capability, or certainly not for the full range, but it's then about documenting what they can make decisions on and what they can't, so that the people around them can be as empowering and enable them as much as they can.
Thank you, Nikki. So Dave has now done his work with Nikki. And yeah, it's gone really well. Yeah, it took a while. He thought he'd be fine to start with, and then actually through the work realised, oh, I did forget to pay that bill until Nikki reminded me. And they put a system in place, and then actually we've got to the point where through the work, Dave has increased insight into what he can do and what he needs help with, and is now set up a system with Nikki, doing more for himself, but also more aware of, you know, I have to have a reminder in my phone to do this, and then another one a few hours later because I will have ignored the first one, and I need this system and I need to stick with this. And after a period of time of doing that, actually it's a good idea to do a reassessment. And as I said before, that doesn't mean that Dave now, maybe he may still not be, you know, doing those higher level financial advisor things, to like may not be ready for a personal injury trust, but it can then still be helpful to do follow-up addendum assessment and report, because then that supports the deputy in having that expert evidence. If the court of protection, like, hang on a minute, what have you done there? You've given him more access to his money, and you know, sometimes any of us can make mistakes. I mean, look at what just happened to Jaguar at a company level, and we're falling for a scam. That doesn't mean that the deputy's made a mistake in doing that. It could be that that's still part of Dave's learning process as he takes on more and more, that sometimes you've got to take some positive risk. And the deputy then has that follow-on report to say, this was from expert evidence. I didn't just go off half-cocked and do it myself. But when I get back to potentially see Dave again, following that period of financial learning and rehabilitation, I may find that he has increased learning. So his actual management of his finances is now better following his work with Nikki. Improved insight. So, oh, actually, it turns out if I just try and do it myself, I don't remember to pay my bills. I have to have the system that we worked on in place. There's concrete examples to be discussed. So instead of just that absence of evidence that I was talking about earlier, where I'm like, well, I haven't got evidence for or against, and the court does like evidence, then I can say, oh, Dave, you did fall for that scam that one time. And he might be like, yeah, I did. And this is why, and this is what I've learned, and this is what I'm going to do differently in future. And that's not happened again. I have had that with a client before, where actually the deputy started giving them like £500 a quarter on top of their existing budgets. They immediately fell for a scam and lost the lot, and it never happened again because they learned from that and they were so pissed off by it. And so actually sometimes that positive risk does need to be taken. And then finally, with the SLT guidance for communication, then I may also have increased individualized ways of communicating with Dave or with another client, so that I can get the best out of them and can understand their communication by whatever means more clearly and can document it better. So you may find that at that second round of assessment following the rehabilitation work, the person either has got capacity or have got clear documentation for the deputy that they should be able to take over permanently, unless there's some negative change in future, this level of finances. And then the deputy has that protection to take, if the core of protection is like, oh, what have you done that for? That's gone a bit wrong there. Yes, I've done that as a result of the expert evidence, not just decided. So that's protection for the deputy as well. Or it may be that somebody's ready to go on to, say, a personal injury trust at that point, having done the work.